Gwenn Fried is a horticultural therapist at the Glass Garden at NYU Medical Center and Project Find Senior Center in New York City. She discusses some of the health benefits of nature and how live plants can positively impact our well-being.
I think, first of all, we all learned in science class when we were young that plants clean the air, plants add oxygen to the air, they regulate humidity. But there's a body of research that also proves that being in an environment with plants, a nice area in your town, that it improves pride and a feeling of safety. Therapeutic horticulture is the use of or the engagement of a client, a patient, or a resident in a facility in a nature based activity that is facilitated by a trained therapist, someone who understands how to use the benefits of nature to their advantage. With any therapeutic relationship, one of the most important things is the rapport and the relationship that the therapist has the with the patient, with the person they're working with. So that's first and foremost. And a well trained, educated therapist will know how to attain that relationship, to build that rapport. And once that is there, the practitioner will be able to harness the benefits of nature, the calming, the blood pressure reduction, the heart rate reduction, harness that and design a program or an activity to best meet the needs of their patient. And it could be any patient of any age. The program here at NYU Langone Health, it has been in the hospital in some form since the early 70s. And what we do is we provide horticulture and nature-based activities to our rehabilitation patients. Now, we work alongside physical, occupational, and speech therapists doing co-treatments. And very often that is honing in exactly on the motivation I was talking to you about before. Sometimes it's hard for people to see why they would do something if they're not seeing results quickly enough. And if you can intersperse a nature-based activity where they can see that they're doing something familiar. I think the biggest thing that we can see as a benefit of therapeutic horticulture is the fact that we as healthcare professionals need to treat the whole patient. Humans are not a car where it gets a flat and you fix the flat and the car goes on its way. They are very intertwined. Their mind, their body, all of those things work together. And you have to realize that when you put somebody in a situation where they're in a stressful, maybe life-threatening, maybe something has changed dramatically in their life, and they have to reassess so many things, that being able to incorporate nature into that, to be able to see life around you and see that there's a hope for the future is very important, because it does, as I said before, put things into perspective. Nature is far greater than all of us. It was here before us, and hopefully if we don't screw things up too badly, it will be here after us. And to be able to bring that to people who probably need it the most, people who can't access it on their own, is very important.